Hi, I'm Irvin from Resilience Occupational Therapy. Today I wanted to talk to you about knee exercises. And when people have knee pain, it's often related to how their knee is functioning with their hip and their ankle. If you have dysfunction in one of those combinations, the knee, the ankle, or the hip, you're likely to get pain in the others, and often the knees are the weak link. So often if we think about one exercise that's going to just address the knee, we would think about just doing some sort of basic hinge joint exercise or something on the knee, or we could address the hip or the ankle. I want to do all three in a dynamic way that really builds resilience, so that if you're stepping on the ground and things twist a little bit, that you're gaining resilience in how your knee moves and bends. So for this, I like to line my feet up at the floorboards so that I have a good straight line going across. Bend my knees, and you can be holding on to something. Somebody's hands could work, or some sort of ballet bar type thing, or you could do it on your own if you've got that ability, that balance. So what you do is you bring your feet over, your toes over, and then your heels, and your toes, and your heels. And then you can reverse it. Heels and toes, heels and toes. Now you try to stay in line. I'm drifting forward a little bit. I call these the Zig Zags. Once you get good on these, and there's a lot of factors you can do to make these easier or harder on yourself, and grade them to what feels challenging but not causing extra pain to your knees. So some of the factors are, this floor right here is wooden, so that actually makes it a little bit more difficult, especially if you're wearing socks. If you were on a rug, that would be a little bit easier. If I were to take my socks off, that would be a little bit easier. So you grade it to your difficulty. You want to have a little bit of that dynamic challenge. Once you feel like you've gotten really comfortable with this, holding onto somebody's hands as you're doing it, and you've played around with different degrees of knee bend, either really low or practically straight, you can try switching to just one foot. If you have a knee that is more problematic than the other, start off with your less problematic knee, and then you do the zigzags on one foot. Now I'm feeling that on both sides of my knee, giving some stability challenges. If I had a sore knee right now, that exercise right now might be a little too much, but it's really strengthening things up for now. So you'd want to build up to that. And then you do the other knee. You go back one direction, and you try to have as much control as you can. You can see I'm slipping around a little bit. And then you can go back the other direction. This is a great exercise to do, especially if you're having fun with it. I really am a firm believer that if you're going to be doing exercises, that you really build resilience to your tissue if you can do something that makes you laugh a little bit and is dynamic. I've had clients who have added this into their dance routine when they have music on in the kitchen and they're just moving around the kitchen. So they've decided to incorporate it so that, oh, I need to get over and put this silverware in the sink. I'm going to do the zigzags to the sink. So if you can try to incorporate it into your routine that way and have fun with it. If you enjoyed this video, if you could like it down below, that would be great. And you could subscribe and continue to get resilience videos on YouTube. Thank you.